Ask the patient to fix on a target in the distance. Use your right hand and right eye to examine their right eye and your left for their left. Start with your feet close to the patient and lean back. Identify the fundal reflex and follow this, moving in on a path 10 to 15 degrees temporal on the horizontal. When you're close to the eye, the optic disc should come into view. Go in closer still and you will get a wider and more stable view. Comment on how distinct the margin of the disc is, the colour of the neuroretinal rim and the cup to disc ratio. Then look for other signs along the 4 major branches of the retinal vessels. Finish by asking the patient to look into the light to bring the centre of the macula, called the fovea, into view. In a non-dilated eye, this will cause the pupil to constrict and you will lose the view. In a dilated pupil, the fovea can be seen as a slightly darker zone with a pinpoint reflection. Repeat this examination on the other eye.